members number over 1 million. So it's a big chunk of the NHS workforce. And we're working to mitigate the effects of climate change, to adapt the changes that are already here, and to promote the health benefits that would flow from making the changes we need to make. Now, I don't think any of you here will need to be told that climate change, or the whole crisis in nature, is the major threat to world health now. And yet, paradoxically, it features very little in the training of health professionals. And it's clearly time for that to change. And that's what we're talking about today. Now, we're going to have 3 speakers. I'll introduce each one just before they speak, and then we'll have plenty of time for Q&A and comments. And the best thing, I think, is for you to put them in the chat. And I may ask you to speak, or I will ask the question for you or make your comment. We'll see how it goes. The usual sorts of things, I would urge you to mute yourself when you're not speaking. And we are going to record this. So if you don't want to be seen here for some dubious reason, then now is the time to leave, because otherwise you'll be recorded. Right, let's get stuck in. So our first speaker is Dame Parveen Kumar, whom I think every one of you will know. Probably the least of her achievements is that she's an ambassador for UK HAC. She's an emeritus professor of medicine and education at Barts and the London School of Medicine, Queen Mary University of London. She has a long-standing interest in global health and its education in medical schools. And she writes the chapter on planetary health in Kumar and Clark, which, again, almost every medical person here will know. It is the most sort of famous medical textbook in the world, which I always say to Parveen makes her the most famous doctor in the world, and nobody can really dispute that. So Parveen, over to you for the first slot.
Richard, thank you so much. Elaine, could you kindly put my slides on? As always, Richard, you're extremely generous. Thank you very much for that warm welcome. I think probably my greatest achievement is being ambassador for the UK Health Alliance for Climate Change. So I think I'll change your introduction. So thank you. Could we go on to the next slide, please? So I'm going to really set a scene of what's happening and where we're going and why we need a curriculum. And as you can see, the current challenges facing the world. Next slide. Next, Elaine. Why not put it on the 2? Press again. Right. So the major challenges of climate change has to be the greatest threat to human health, because it really encompasses everything we do. So in that we've got changes in diseases, the new diseases, and of course the re-emerging diseases, particularly the infectious diseases, which we thought we had a handle on. Now, of course, we're going to be coming back, and I suspect it's not too unreasonable even to think that we may well have endemic malaria back in this country. Now, with the climate change and the problems with starvation and so on, and floods, which we've seen, we'll get a displacement of refugees, and you get the crisis of war, and wars, obviously, displacement as well. Next. And the 2 things that I think are going on in the background, which will in fact affect us as well, is the antimicrobial resistance, because it may well be that shortly we won't have a cure for pneumonia, as simple as that, and people will die. And the other one, of course, is obesity, which is rampant. Another couple of years, a third of the population will be, in the UK, will be either obese or overweight. And next slide, please. So I'm just going to change you the sort of 6 scenarios we have. Next slide. Thank you. So I'm going to go through from the top downwards. So if you look at the floods that we've had, they've been absolutely chaotic, and it's easy to imagine how the clean water and the dirty water are going to mix up, and we're going to get a lot of waterborne diseases, and maybe cholera, which we hope we're going to get fewer deaths is coming back again. Typhoid, hepatitis A, the amoebic, the dysenteries, the helminths, and of course malaria and dengue. As the climate gets hotter, they will have a faster cycle and therefore come back again. Next, you've seen the fire. Next, Elaine. With fire, the air pollution from fires, which we've seen around the world, and also burning of crops in the east, and that of course affects respiratory problems as well as cardiac problems. Next, look at the left, you've got the loss of habitation for animals, and this is deforestation with trying to cut down trees for agriculture, but also, as you can imagine, when that happens, the animals have to leave because they haven't got any habitation. They come into human habitation, and of course that's where we get the zoonoses. And of course with deforestation, of course we've lost the Amazon's major, which used to be the major carbon absorber, now is in fact emitting. And then the last thing on the left, Elaine, shows how with the melting planet, coastal towns are going to be affected. There's going to be failure of crops with starvation, again population migration, but overall the major problem is going to be mental health, which of course is already the commonest disease in the world. Thank you. Next. So what are we doing in the NHS? We are doing quite a lot, and we are hoping to achieve net zero by 2040 with an 80% reduction perhaps by 28 or 32. Now, as an NHS, we probably add about 10% of the carbon emissions for the country. And a lot of that is from just transport, from the way we use medicines and the way we work. And, you know, for example, gases that we use in anesthetics and desflurane. So hopefully we are all working very hard at that. Next slide. So why do we need a new or indeed an incorporated curriculum for climate change? Well, for many reasons. I must say at my medical school, I've been talking about it for 20, 30 years, but obviously never achieved anything. It was the students that really made it happen. But we need to train our students and indeed ourselves for new challenges. We've got to look at the eco-health and the sustainability of all that we do wherever we're working. But we do need leadership, and we need it. All of us have to be leaders for climate change and indeed champions for climate change. And the other thing I think about the climate and the world and the planet, we've got to have collaboration, not only just between within the country, but between countries, because as you know, climate doesn't have any borders. And I remember being in Liberia once and looking at the WHO chart, they had exactly what was going on in all the other countries nearby. So I think that is very important in what we do. And therefore, this curriculum needs to be passed on, I think, to other countries as well. So back to the medical students who are highly engaged already, and they're bubbly, enthusiastic, and are desperately worried like we are. And from Los Angeles, they produced a planetary health record, which is really a metric, for those who don't know, for the students to say what they're doing for climate change with the medical school, really holding the medical school to account what they're doing. And that covers all sorts of things like the curriculum, about research and interdisciplinary research in terms of environment. It covers outreach community work, and also student-led initiatives are supported, and also looking at the campus sustainability. There are medical school societies for climate change, and I've spoken to many of them, and there's huge enthusiasm there to move it forward. And of course, we have the International Federation of Medical Students Association, and I've just put the book there on the right, really, which was actually in collaboration with them. So they have a reach of all the medical students around the world. And this book, in fact, was written by 127 medical students from, I don't know, 60, 70 countries. So it just shows things can be done and will be done. And I'm very much looking forward to the next two talks, which are really about how we either have a new curriculum or we incorporate that curriculum into what we're doing already in every topic, every specialty, and then what we do with the postgraduate. So Richard, thank you very much. I was only given 10 minutes and I hope I haven't exceeded that.
No, well, thank you very much, Parveen. I mean, I think you've clearly shown the need for for this education. You've emphasized how long it can take to arrive and how medical students and other health professional students are taking a lead. And I hope we'll hear from some of them in the discussion. I should say that Students for Global Health are members of the UK Health Alliance and a very important part of our membership. Right, so there's the problem, there's the need, there's some beginnings. Let's move on to what is happening. So we're going to hear from Dr. Sanyumay Tun. She has a background in 3 areas: in medicine as a former general practitioner, in environmental science and policy, and in medical education. She has an international presence in bringing planetary health and sustainable healthcare into professions training. She teaches at undergraduate, postgraduate, and faculty development levels, and she led the development of the Education for Sustainable Health curriculum we're discussing today. So there's nobody better than Sanyumay to tell us what's going on and what we need to do. Over to you. You're on mute.
Thanks very much, Richard, and it's really wonderful to be here. And Elaine has my slides. Beautiful. So I'm going to be talking about embedding the new curriculum into medical education. And in fact, I think I can put the curriculum into the chat as well. So if next, please. So in case somebody's not got the chat, then I've even made a QR code for this document, which has been endorsed and published on the website of the Medical Schools Council, which is the umbrella body of all the UK's medical schools next. So the reason that we need to have education for sustainable healthcare is partly, and in medical education, it's a requirement. It's because it's in outcomes for graduates. So the General Medical Council, which regulates how doctors, what doctors must know in order to graduate as doctors, uses the word must when it's mandatory. So newly qualified doctors must be able to apply principles, methods, and knowledge of sustainable healthcare to medical practice next. And they had to show by 2020 how they were doing it. Next, please. Sustainable healthcare has different definitions. This one was accepted by AAMI, the International Association for Medical Education. So here I've said that it focuses on the improvement of health, better delivery of healthcare. So it benefits patients, it benefits ecosystems, and it provides high quality healthcare now, without compromising the ability to meet the health needs of the future. Next, please. And this is the AAMI consensus statement. We worked for a year on it. People from 5 different continents, about 32 health professionals of various professions, so physios, nurses, doctors, dentists, even students joined us. And you can see there on the left that there's a diagram where education for sustainable healthcare sits within the wider sphere of planetary health. And that's really important because planetary health was actually added into the title of this document because we felt that it was essential to have that. Next, please. So you can see here a similar model on the left where you have the environment. And the environment is that within which society sits. And the economy is a construct of a society, rather than the weak sustainability model, where you have the economy almost as a separate entity that must be preserved at all costs and balanced against society and environment. And that is has fallen out of use. Next, please. And so we come to planetary health, and planetary health again has had various definitions, but the Planetary Health Alliance defines it as a solutions-orientated transdisciplinary field and social movement. And it's focused on analysing and addressing the impacts of human disruptions on Earth's natural systems, these effects on human health and on all life on Earth. Next. So we can see that climate change isn't the only thing that we need to be thinking about. We need to think about biodiversity loss and agricultural land use. We need to know about the social foundations for health and well-being, like social equity and political voice, where these are lacking, and also contribute to the shortfall in health. Next, please. Next, please, Elaine. So biodiversity loss is really important, and it's been shown to affect production of agricultural yields. It's also been shown to cause deaths, so nearly 500,000 deaths each year from biodiversity loss, and as well as, of course, the loss in agricultural income. Next, please. And where you have these impacts impacting on each other and multiplying, I think that the younger population, the younger generations of doctors and trainees are much more aware than those of us in the older generations. And so if you just press next again, Elaine, they are much more aware of where we are in this escalating disruption and collapse of systems. Next. So we also have to deal with the emotional responses to climate change. We have to deal with those responses from those people that we teach, our students, our trainees. We also have to deal with this in ourselves, so the educators themselves coming to terms with having to teach about these things, and also in the patients that come to us. Increasingly, patients are coming with the depression, the grief, the anxiety. Next. So the solution is to take action, because only with action is there hope for change. And of course, if you want to have hope, then action will help you with that. Next. So we have here the latest Lancet report of the Lancet Countdown, and it says that the policies that we're seeing, the strategies and what's going on, is increasingly threatening the health and survival of all people and future generations. And of course, an immediate health-centered response can still secure a future for all of us, all of life on Earth. Next. So hence this curriculum for education for sustainable healthcare. And you can, next please. So here you can see an explanation of why ESH is needed, the definitions that I've just given you, and the responses from the GMC and so forth, the demand from students, and then the frameworks and resources that were used in order to develop this curriculum. We were not reinventing the wheel, we were taking everything that was there already. And I'm very privileged to have worked with a working group of colleagues, some of whom are on this call. And we developed this from our own teaching, as well as from all the resources that we have access to. So we've also put in there about approaches to curriculum delivery and assessment, faculty developments in there, the key foundations for education for sustainable healthcare, so things like planetary health, health inequalities, environmental equity, ethical medical practice, and then, of course, the health benefits if you take action to avert the planetary crisis. Obviously, the health impacts of the climate and ecosystem crisis, and the harms to health with heat and air pollution and water pollution, food supply, etc., infectious diseases. Those are gone into. We supply resources for linking to those. And then what we've done is done the additional impacts by medical specialisms. But to be aware that actually you can't just go into one of these specialisms and think, yes, I've taught it in my specialism. All of this is relevant. So everything about the planetary health and the equity, inequalities and so forth. Next, please. Obviously, the impacts of healthcare on our environment is important. And we give examples of tools for sustainable clinical practice, such as quality improvement, social prescribing. And this curriculum itself is a resource for sustainable healthcare and teaching. NHS Net Zero Commitment, which has come online and is very helpful as well. But the most important part of this curriculum, the way we see it, is the part about professionalism, leadership, and achieving structural change. So the professional competencies in planetary health, how to communicate sustainability values, promoting organizational change. Next, please. So the aims of the ESH curriculum are to be as self-explanatory as possible, to be user-friendly across various curricular structures, to be concise, and to have links to high-quality sources of information. Next, please. The GMC has said this curriculum provides relevant and helpful detail to support medical schools to meet our outcomes for graduates. We'd be happy to support an approach to sharing good practice amongst medical schools in the delivery of ESH with reference to this curriculum. And they have published it within their further reading list that supports outcomes for graduates. Next. And they will be logging this new curriculum as a point of reference for future iterations of outcomes for graduates and other related guidance. Next, please. So the wider impact of this curriculum has been that it will be reflected in the next outcomes for graduates. It's also going to be in the upcoming good medical practice. There's been international interest, so some places around the world are beginning to use this curriculum already in other health professions as well. And there was a COP, I was asked to speak at COP27 about it. I did it online because I haven't flown for a few years. And again, it covers the breadth of the Planetary Health Report Card. Next, please. So this is the COP Health Pavilion, which for the first time was within the blue zone, is where the delegations happen, where the delegates go for the negotiations. So this was a great achievement for the Health Pavilion to feature within the blue zone. Next, please. This is the Students' Planetary Health Report Card Initiative. So it's an international endeavour. The metrics are validated by a literature review. Next, please. And for the UK, this is a sort of like a needs assessment ranking. So I know that medical schools like to go up league tables, but this is more like a needs assessment and a guide to what medical schools can do in order to achieve the ambitions of the students. Next, please. There has been a more recent initiative in the UK for the specialties, where trainees have put together this climate and health scorecard initiative, and they've surveyed categories like internal operations, educational training, divestment and advocacy. And if you just look at the colleges down the left-hand side, and then next, please. This is their chart for education and training. So on the top, so how planetary health is embedded in the curriculum, and you can see the various royal colleges and so forth, the Faculty of Public Health, all obviously doing very well in the education side. Next, please. So the key aspects of education for sustainable healthcare and planetary health are that sustainable healthcare is good medicine. It's a win-win for the patient and for the planet and for the practitioner. So it needs core teaching of the fundamentals at key stages when trainees move from one stage of their education to the next, or years of the course in medical schools, and it's applicable in every subject and specialty. You can connect with ESH principles in everything you're doing in the same way that you might talk about professionalism or patient safety. And indeed, you have to embed in it assessment. Next, please. So for graduating doctors, there's the MLA or Medical Licensing Assessment, and it has 3 themes: readiness for safe practice, which is what most medical schools have been concentrating on to date. But also there's managing uncertainty, so the ability to cope with uncertainty over diagnosis, to talk about prognosis. And it's really important for trainees and junior doctors to be trained to talk to patients about prognosis, delivering patient-centered care. So listening, hearing patients' values, taking account of comorbidities and frailty in social context. Next, please. So within outcomes for graduates, these are things that were new for 2018, dealing with complexity and uncertainty. Recognize how treatment and care can place an additional burden on patients to make decisions to reduce this burden where appropriate, particularly where patients have multiple conditions or are approaching the end of life. And obviously about quality improvement and recognizing the potential consequences of overdiagnosis and overtreatment. Next, please. These are just some other areas in outcomes for graduates that are applicable to sustainability teaching, so not just the environmental impacts, but here about cost effectiveness, prevention, patient self-care, stopping medication, not over-prescribing, and understanding about health inequalities and the social determinants of health. Next, please. The other thing to consider, especially in our, in all clinical practice really, is defensive medical practice. And the forms of defensive medical practice are pervasive, and to the extent that they are, it is harmful not only to the patients, of course, but it's linked to burnout in the physician. Next, please. So there are various organizations, initiatives, movements to promote person-centered sustainable healthcare. So Realistic Medicine in Scotland, for instance, Prudent Healthcare in Wales, linked with the well-being of future generations and so forth. Choosing Wisely is the international equivalent. Next, please. So these are questions that Choosing Wisely, Realistic Medicine and the Royal College of Physicians and Surgeons of Glasgow have suggested that for patients to use in shared decision-making. Next. So is this test, treatment or procedure really needed? Next. What are the potential benefits and risks? Next. What are the possible side effects? Next. Are there simpler, safer or alternative treatment options? Next. And what would happen if I did nothing? And that's really important. Next, please. Because the GMC has put out guidance on decision-making and consent, which says very clearly that you must put to the patient the option to take no action. That's entirely different from the option to refuse the treatment that's recommended. It means that you have to put upfront and clearly that there is an option to take no action, to do nothing at all. Not, next, please. And this also fits in with the principles of sustainable clinical practice, which I think that you may have seen before. You can use this driver diagram and use the ways to reduce activity and reduce carbon intensity in your own practice in any specialty, and you can do that without reducing health. So at the top, you see prevention, which is first and foremost and the most important. Next, please. So let's focus a little bit on the prevention now. Next. And this is the way that I see the principles of sustainable clinical practice. The prevention side does the most good and has the most impact. Followed by patient empowerment and self-care, then lean care healthcare systems and low carbon alternatives. Next. So planetary health feeds into prevention, and prevention will mean that there are less resources used and therefore better for planetary health. Next, please. This is a meta-study that has looked at healthcare in the US, England and Australia, and it says that 60% of care is in line with guidelines. That doesn't mean that the care is effective. 30% of care is waste, duplication or of low value, and at least 10% of patients suffer from iatrogenic harm or adverse effects. Just imagine if the 10% of patients didn't suffer this harm, then they wouldn't feed into the top again to have require more care. But if you were to take away the harm and the waste and just use the care that is within guidelines, and again the guidelines themselves might be updated, you could pretty much eliminate half of the stuff that we're doing, and that again would constitute sustainable healthcare, because you can reduce all of the impacts of healthcare provision by doing this. Next, please. And so this paper gives some key recommendations for clinician action. Clinicians must work to reduce the incidence and severity of disease, to decrease the amount and intensity of care required, optimize resources, and obviously the pathways of care. But at the bottom it says health professionals should encourage change through individual practice, influencing healthcare organizations, and contributing to standards and policy. So that again is sustainable healthcare. That's why we're educating for sustainable healthcare, not just to do with carbon emissions. Let's not have carbon tunnel vision. Next, please. So the take-home points here are: we need both to understand and act on planetary health, and to practice sustainable healthcare. Do use the curriculum document, adapt the resources of this curriculum to your own context. There are hyperlinks to high quality resources, so they're very easily accessible. They will be updated regularly. And of course, embed in assessment in whatever specialty that you are. So next, please. So I'll stop there, and thanks very much, Elaine.
Well, thank you very much, Sanyu-May. That was very impressive. And I think the work that you've done on the curriculum is very important. And an obvious question that we'll come to in the discussion is how much the curriculum has been taken up. I like the fact that you emphasize it's not just about climate change, it's about broader biodiversity and nature problems, emphasize the importance of action for making you feel better. And I like the way that you incorporate that a lot of what you would teach in sustainable healthcare is actually a lot of good medical care or healthcare, full stop. Right, now we're going to move on, and we're talking a lot there about undergraduate medical education. I hope we'll hear a bit more about other health professionals. It's in a minute. We're going to talk more now about postgraduate education, but before I introduce Anya, I remind you, we'd like you to put questions into the chat. You can put them in at any time. You don't need to wait till the end, and you might want to respond to the many interesting points that Parveen and Sanyu-May have already made. So Anya Burns, Professor Anya Burns, is the Senior Censor and Vice President for Education and Training at the Royal College of Physicians. She's a consultant nephrologist and Director of Postgraduate Medical Education at the Royal Free Hospital in London. She was promoted to UCL Professor of Postgraduate Medical Education and Nephrology in 2017. So another excellent person to hear from. Over to you, Anya.
Thank you very much, Richard. Elaine, I'll try and share my slides because it might make it easier if that's okay. If I don't succeed, we'll move to you sharing them. Now, can you see those? Is everybody?
Yes, we can. You could make the screen a bit bigger. We're seeing all of your screen. If you click on,
okay.
Make it.
Yes, I will do slideshow. I'm trying to identify how I can just get my slideshow underway. Excellent. Is that better, Richard?
No, I think you have to do it on your computer, not on the screen.
Okay. How's that?
That's it. You've done it. It's
Great.
There. Perfect.
Excellent. So Richard has given me a very kind introduction, and I want to thank UK Hack for giving me this opportunity, and a shout out to my friend Juliet Boyd, who I think made the links so that I ended up giving this talk. Juliet is a huge supporter of sustainable healthcare, and it's through witnessing role models, I think, that we change our practice and behavior. So I hope in the next 15 minutes or so, I'm going to give you a perspective on postgraduate medical education. 3 of my children are doctors, and so, if you like, I have lots of vested interest in this area. So a word about the Royal College of Physicians. We've got 40,000 members and fellows in the UK and around the world. We hold the voluntary register for physicians associates. So we were talking about other healthcare professionals. We have 30 specialties within our umbrella and 6 faculties. So we reach quite a lot of healthcare professionals, and importantly, I think we reach professionals who also influence others. So the opportunity for us to cascade good healthcare practices, I think, are pretty huge. And we at the RCP, I think, genuinely take that seriously. When I was researching for this talk, I saw, and I think Parveen, maybe you mentioned this, that most NHS staff support the NHS net zero policy. So I think there's a real appetite for improvement and change. So when I was thinking about this, I was thinking about, well, what can we do as individuals? How do we role model things that will help? And obviously things like switching off lights, cycling to work, thinking about our sphere of influence, printing less, traveling less, and so on, are all very important things that we can do. And we should be in no doubt that others watch what we do. In my own small sphere of influence in my postgraduate medical education centre, together with some trainees, we were able to put in a petition for changing the lights in our toilets so that they only come on when they're activated by movement and therefore off most of the time. So I think leadership in our healthcare roles is very important. Sanya May has talked about championing and role modeling. An example, again, in my own dialysis unit, where we use a lot of energy, a lot of water, and a lot of plastic, is one of our technicians has devised a system that now we make our own solutions, our own dialysates, so we don't need the plastic and we use a lot less water. But I guess why I've been asked to talk this afternoon is to talk about our college and our role, and also by implication what other colleges can do. And when I was getting these slides together, this popped into my inbox, and it just reminded me that retailers and industry know that people are interested now in sustainability. And you can see here an ad trying to entice me to buy a jumper, but pointing to the fact that this retailer supports sustainable fashion, local craft, and that the product is responsibly crafted. And I think this is very good and bodes well for the future, that individuals like me and healthcare workers are reminded all the time about our responsibility for the climate. But at the Royal College of Physicians, we have 3 missions, if you like. We aim to educate, we aim to influence, and we aim to improve. And all of these overlap really when it comes to sustainable healthcare. And I'm just going to spend a few minutes going down through each one of these, but just choosing examples rather than trying to cover everything. And please do ask any questions if I leave out something that's gapingly obvious. So in terms of education, we're involved in curricula development, in standard setting, examining, and Sonia May has emphasized the importance of assessment and how we change practice by examining. I'll come back to that a little bit later. We also are involved in supporting lifelong learning, and we're very much involved in developing leaders for healthcare and in retaining a sustainable workforce. You may be interested to know, and some people on the call may not know, that our conference this year, which will be held at the end of March, and you can see our advertisement here, that our theme this year is sustainability. So in addition to clinical learning, we'll explore the climate crisis and its impact on healthcare. And I think that's a very good development. And the RCP are going to help create a podcast as well from today's workshop. We certainly aspire to educating our community in sustainable healthcare. But it is true, and this is an article about what are the barriers to integrating sustainable healthcare into healthcare education, and why have we not made more progress? And not too surprisingly, things like space in the curriculum, competing topics, lack of faculty expertise came out in the reasons for why we are slow at making progress. And I think as we develop our faculty expertise and as we develop mechanisms for integrating the curriculum, hopefully we will improve and make sustainable healthcare a reality. So the participants in this qualitative study were asked for solutions, and they felt that framing climate change in health terms, establishing learning objectives and protecting faculty time, identifying connections between education for sustainable healthcare within research and the curriculum would help in achieving our goals. Leadership has been mentioned, and again in this study, they felt that campus leadership would facilitate successful ESH integration. And training of the faculty, of course, is urgently needed. A word or two about leadership. The Royal College of Physicians, we have many leadership opportunities, leadership training opportunities. We, for example, run an Emerging Women Leaders course, a 6 steps course for new consultants, and a Chief Registrar course, and courses for clinical directors and things. But if we're to achieve sustainable healthcare, that strong leadership is really important. We need to create leaders who think about systems, who think about change management, who are well versed in quality improvement, and who use narratives and storytelling, which we know are very powerful tools when we are trying to embed learning. So I think there's a whole load more to do. Sonia May has talked about learning that supports holding risk, and we have almost by default got ourselves into a very risk averse method of practicing medicine. So we need to rethink, how do we train our colleagues and also school ourselves to investigate where it's appropriate, to avoid over-investigation. And as a nephrologist, I have led on conservative care for end-stage renal failure, where whole person decision-making, holistic care, and just because we can dialyze somebody, is it always the right thing to do, and so on. So over the past decade and a half, we've actually created a new mode of treatment that for many patients is much more suitable, number one, and also gives them a much better quality of life. So it's learning how we deal with treatment futility and over treatment of our patients, and that's an area where the college really wants to help and be involved in. In terms of influencing, we of course need to be involved in communicating the adverse effects of air pollution on health. For example, we're all aware of the first time when air pollution was listed as a cause of death in the UK for 9-year-old Ella. And the coroner, or the report from the coroner, stated that the adverse effects of air pollution on health are not being sufficiently communicated to patients and their carers by medical and nursing professionals. And this really presents us with a challenge, and it's one of the many challenges we have. And as a result of this, the RCP was required to respond on this point. It came up with a response, which I've put on this slide in June 21, where we promised that we would work with specialty societies and various other bodies, including UK HAC, to continue to raise the profile of the impact of air pollution on health, review the delivery of internal medicine curricula, decide how to increase the knowledge amongst physicians, and produce and actively promote resources that would help medical professionals better understand the impact of pollution, and have conversations with patients and their families about avoiding air pollution and mitigating its impact, and then continue to work with government and the NHS to improve incentives to have these conversations, and systems that address this issue. And we vowed that we would help medical professionals to become local advocates for reducing air pollution, and that we would continue to urge national and local government to tighten regulation of pollution generating activity and improve public information. So how have we done? We have our conference, as I've said, this year, the theme of our conference is sustainability in healthcare. We have some of our named lectures. The Samuel Gee lecture in 2022 was on air pollution. We include information and updates in our RCP medicine podcasts and in our magazine called Commentary. We publish our responses to formal consultations, and we work with our media department to promote clean air whenever we can. With regard to implementing the internal medicine curriculum, and with regard to improving, or if you like, emphasizing air pollution and in the curricula for internal medicine trainees, those that have responded to us feel that there has been a shift and will continue our work. As I've said, there's lots more to do, and like Sun Ying May, I believe that one of our next actions is to get into the question writing committees and the question setting groups, because how do we really make an impact in terms of implementing curricula? You examine what's in the curriculum. And I think it's finding ways of doing that, and doing that in a useful way. And once again, the college will continue its work on influencing, for example, DEFRA air pollution targets, because sometimes working in the college, it feels like the powers that be in government don't take any notice of us. But I do think actually 40,000 physicians' voices can influence government, and we spend quite a lot of effort trying to do that. The other thing we're doing is we're always trying to improve healthcare, and at our conference later in the year, we're going to launch a new platform called Medical Care Driving Change, which will be a platform where we will share, or clinicians will share good practice, and, for example, quality improvement projects, particularly around sustainable healthcare, will be showcased and will be, if you like, templates for adopting similar change and initiatives in individual trusts will be shared. I've mentioned already our Chief Registrar program. This year we've got over 100 registrars who are in their senior years of training, and they have protected time for leadership and management training, and they also take on local projects in their trust, many of which are about sustainable healthcare. So we will continue to promote that, and I think it's a wonderful opportunity for us to assist in delivering on our objectives. I've just put a link there to our conference if anyone is interested, and thank you very much for your attention.
Good. Thank you very much, Anya. I mean, I like the way you emphasize the importance of recognizing that we're role models. I mean, I've heard people say you get taught one thing at medical school and then you go out into medical practice and you see something else altogether, and that has more influence of you. And you emphasize leadership and how the colleges can play a central role. And one of the things I always say to colleges, our members these days, is whereas you might have thought this was something sort of marginal to what you did, it's now absolutely central to what you do, because we've got to have sustainable healthcare. And you talked about Ellie Kissy-Debrah. It's the anniversary of her death today, and there's a great meeting tonight that I'm going to be going to. And the UK HAC, we've weighed in a lot on Ellie's Law, as it's called, which is currently being debated in Parliament. Right, now can you remove the slides, Elaine? We need to see as many people as possible. We've had lots of talk from doctors, but we are an organisation of health professionals, and so I've invited Rose Gallagher, who's from the Royal College of Nursing and is on our executive, just to say something very quickly about what the RCN is doing. Rose.
Thank you, Richard. Hello, everyone. Lovely to see you. So we, like many other organisations, are really in the early days of looking at our educational offer and what it is that our members need to support them on their journey with sustainability. We have finally launched, I say finally because this work actually started 4 years ago and was delayed due to the pandemic, launched our 20 credit level 6 or level 7 program on sustainability, and we've built the model on the program that we developed for infection prevention and control. As I said in the chat, this is very much about what sustainability means to the students in their role, recognizing that sustainability and action on climate change is huge. So we focused very much on principles of sustainability. The whole program is mapped against the Sustainable Development Goals, and it's intended to be a practical program, but clearly there are theoretical elements to it. And I really enjoyed listening to the conversations around leadership, because this is a huge part of the program for us, and we've built on our experience of delivering a clinical leadership program for nurses now for many, many years, which has been extremely successful. Some of the key learning points for us around leadership and influence is really supporting nurses to understand and work within their circle of influence and circle of concern, because for them there are many different limitations on what they are able to influence in the workplace and within their professional role. And we need nurses to really focus their energy on where they can be most effective. So Stephen Covey's circle of influence and circle of concern is a really important aspect for us that allows them to build then on the theoretical principles that we give them in the programme on the science of climate change, what it means to health and care delivery, but also how healthcare contributes to issues around climate change, excuse me, and broader sustainability, as well as theory on advocacy and lobbying. And we're very fortunate to have Professor Rupert Reed supporting our programme and talking to our students around focused activity on lobbying and advocacy within the limitations of our role as nurses and also citizens, because we are bound by our NMC code and we have to act and remain within that. So a very practical approach to sustainability, lots on procurement and how to move people to get to yes, whatever getting to yes means for you in your role. So that's it in a very, very quick nutshell. Richard, does that help?
Yeah, no, thank you very much. I mean, it's important to recognise it because we've heard from 3 doctors, but there's lots going on with other health professionals as well, and perhaps we'll hear a bit more in a minute. Before we get to the questions, and what I think I'll do is, there aren't that many of us, there are 52 it says here, so I'll let you ask your questions yourself in a minute, but I just want to ask Sanyu May right at the beginning, what has been the uptake of the curriculum? Are medical schools beating down your doors to incorporate this curriculum and put it into their exam system?
That's yeah. So I think we have to start with how busy medical schools are and how much they've got on their plates already and how crowded the curriculum is for each medical school. And the fact that educators actually don't know this stuff themselves. So it's a steep learning curve for them, plus the emotional aspects of, I don't really want to deal with this kind of, I don't want to deal with climate change. I don't want to deal with, sort of the planet falling apart or systems falling apart. So what we're doing is working with the Medical Schools Council and forming a network of one champion, not necessarily the person with the title of ESH lead, but the person who wants to put effort into pushing for change in the curriculum. And if in each medical school we can identify one person who is very committed to doing that, then we will have a network where we can work together and help the medical schools to implement this, because clearly there is the demand and there is the requirement and there is the resources. It's just getting the momentum going. So yes, there's been international interest, which I was quite sort of encouraged by, but the interest in the UK on taking up this curriculum itself, despite the fact that it was reviewed by the Education Leads Advisory Group of the MSc, so the Medical Schools Council's people actually endorsed and published the curriculum. So, we have to help them.
Yeah, and actually, just before, can I ask you one other question? I heard the other day that the person who teaches climate science at UCL, climate science, not just in relation to health, actually has counsellors attending his course the other day. He offers counselling because a lot of the people who attend his course are so shocked by what they hear that it creates a lot of problems for them. You referred to this briefly. Is there any provision made for that when teaching health professionals?
It's there in the curriculum that it's necessary. When I teach, and I teach at all sorts of levels, I always include the emotional impacts. I talk about climate anxiety, solastalgia. I refer people to the Climate Psychology Alliance. And I also get people to emote. I also get people to actually try and attune to what it is that they're feeling so that they can move on. Because if they can't listen to themselves and how they're feeling about all this, they can't move on and deal with the situation.
I'm going to ask people to ask their questions in a minute, but Rose, did you want to comment specifically on this?
Yes, just to say that we've included specific content and practical exercises around climate anxiety, recognizing that we can't actually deliver a program like this knowing that people are going to be anxious as a result of it. So we did this with 2 mental health specialists, Stephen, who works alongside me as professional lead for mental health at the Royal College. So we have like a panel discussion and also some practical exercises, but it's picked up as a theme throughout the program.
Good, thanks, Rose. Right, Nico, let me give you a chance to ask a question. You'll need to. Are you still there, Nico? I can see you, but you're not. Yeah.
Are you talking to me?
Yeah. Would you
Okay.
like? I saw your question in the chat. Would you like to ask your question yourself and
Yes.
just quickly tell us who you are?
Yes, thank you. My name is Nikolaus. I'm from the German Alliance on Climate Change and Health, and actually currently based in Sweden, advocating for curriculum on sustainability and planetary health here at Karolinska Institutet in Stockholm. And thank you so much for the awesome presentations. We have a meeting next week with some of the leadership of our university and want to discuss the broad implementation into the curricula. And one argument I feel like they will bring is like educators, they don't want to talk about this. And Dr. Thun, you mentioned and Dr. You mentioned someone, and Professor Burns, you also mentioned in these surveys some of the obstacles that educators have felt. So how can we scale up? How can we find more personnel among the faculties to train the hundreds and thousands of health professional students that we have at the universities across Europe? How do you deal with this? We know that UK is a role model for all of us in Europe, so we're looking towards you. Thank you.
Thank you, Nico. So, Sun Yu May, if you answer that first, and then I'll ask Parveen and Anya to comment as well if they want to.
So I did do research on how to teach and learn sustainable healthcare in the curriculum. I don't know whether you've seen the article Fulfilling a New Obligation, Nico. Basically, one of the things that I found from the research was that if you dissolve the hierarchy, if you don't say, well, I'm the teacher, you're the learner, so I'm going to impart my knowledge to you and you're going to do what I say, but actually accepts that maybe the generations coming up know quite a bit about this and learn together. You can have learning sessions where the educators and the students are both learning. And that was the thing that I came up with, and I've applied it myself, and I've encouraged others to apply it because, you know, we all have to act very fast, and just breaking down these hierarchies does work. The students do the learners do come up with exciting and very viable ideas, and also in clinical teaching to get them to challenge what they're seeing. I mean, not to say, well, you're doing this wrong, but to just ask questions about, well, have you thought about this, or what are the sustainability aspects of that, or, you know, do you think that this would impact on planetary health, etc.
Yeah, that's a great answer. I mean, I think this philosophy of all teach, all learn, that's always what I do whenever I teach. And Nico, you probably know much more about this than your professors do, so you shouldn't feel ashamed of that. So Parveen, do you want to comment on this? You don't have to.
No, I was just listening in and thinking, you know, one or two suggestions Sun Yu May has already put forward. But I think the students are key. If they keep on pushing and saying we need it, I mean, it's their future, the educators will have to learn. And if we keep talking about it, they'll be the ones who turn the place around. I have to say, certainly in a couple of universities that I've been to, it's the students who've actually made the educators go off and learn and then come and educate. So I think it's very much all of us playing together and learning together, I think.
Thanks.
Just the other point
Sorry,
is, just one last point, and that is there's no doubt if you look at the curriculum, the only way to get students to really, if students aren't engaged already, engaged in it is by having a question in the exam. And a lot of them said to me, you know, we're in our final year, we actually don't want to, we don't know, because it won't be in the exam. And I said that life is not all about passing exams. Life is about living. So if you're not going to do this, you won't be alive to actually do anything. So put them in the exams. Questions?
It's a good way to encourage them. Anya, and then I'll give Nico a quick opportunity to come back.
Yes. Well, I must say, sadly, I do think that putting it in the exam is is the fastest way to get people to do the reading and the background. But for me, it's about having it become a contagion, that everybody sees it around them and does it. And I think we're in a position, the evidence would suggest that people are interested and want to do this. So it's seeing others doing it, and it's also suggesting easy, quick wins for people to do it. And it's about coming back to Sanya May, your point about this is good medicine. This is good for patient care, and we're all about promoting good medicine. So when you if you like, frame it in that light, it becomes something that everybody wants to do. But I absolutely do not think that things like curriculum mapping it to a portfolio will help in any way at all. It'll just put everyone off. We have a tendency in postgraduate medical education to get people to curriculum map their activities, and I find the trainees tell me that just makes them resent what you're trying to deliver. So I think it has to be much more trainee led and observed by those around them. So thank you for the opportunity to talk again.
Thanks, Anya. Nico, do you want to make a quick response?
Yes, thank you. Very insightful. I'm taking notes. But if this, so the gist of what I'm getting is from your answers is that it's kind of grassroots. Like all of your answers point towards like grassroots, role models, trying, teachers learning from students pushing for change, etc. But how can we reach this system change? So take a faculty with 1,000 medical students. In 5 years, they have 30 subjects. We want planetary health and sustainability and at least 10 of those 30 subjects. So we need educators in each of those 10 subjects to teach it, at least one, maybe optimally like 2 or 3. How do we scale this up faster than by grassrooting, like emailing, like having meetings and then trying to convince people? This takes a lot of time, and find these champions in all of these. Find these champions. It's hard to find them sometimes also, it takes time. It's
okay, Nico, I'll stop you there.
how to
It's a challenge.
teachers.
It's a challenge for you. We're looking to you as a young person to make this happen. So
what I do and have been doing across the UK is sometimes there's faculty development sessions, so like a half day or a lunchtime session where you do a train the trainers or teach the teachers session. And it really only needs, I turn up and maybe spend an hour talking and discussing, and then the penny drops and they think, well, this is to do with my clinical care. I can teach this when I'm teaching about clinical care, and it works. And then they go off enthused, and then, that sort of like unlocks the door. Whereas if people go around thinking, this is about, sort of, I need to know about the carbon emissions of this thing that I'm doing or whatever, it's more of a barrier, because it's not fact-based. It's mindsets. It's a lens or a perspective to what you're doing. And of course, you need to explain that it's good for clinical practice and it's good for patients and it's good for the planet, and therefore your patients aren't going to get ill in the first place. So it does need some kind of structured faculty development at some point, I think.
Right, thank you, Sonia. So actually what I'm going to suggest now is I'm going to ask 3 of you to ask questions quickly, and then we'll get the 3 to respond so we can get through a few more. Firstly, I want to explain to Richard Thomas has asked about the role of NICE in all of this. And I think I won't put that to our speakers because I think that's slightly tangential, but we will be having a meeting, I think, on what NICE is doing, because NICE is beginning to take this seriously. So Emily Lewis from the College of Obstetricians and Gynecologists, would you like to ask your question?
Yep. Hi. Sorry, I can't get my camera to work. So my question was around obviously if we've got education in medical school, but then what other what education doctors need around explaining the impact of treatments, and particularly I was interested in talking about over-treatment and futility of treatment. Just because I'm aware, that like at the RCOG we make decision aids already, but just like what other support doctors need to have that conversation in like a kind of nuanced way, if that makes sense.
Yeah, thanks, Emily. So Ben Rossington, would you like to ask your question? So I'll get you to respond to these in a minute, the three of you. So you might want to write something down. Ben?
Thanks, Richard. Sorry, I also can't get my camera to work. I was just reading about social prescribing recently, and I want to know if there's evidence that social prescribing reduces the carbon impact of health interventions, and also whether there's education on the kind of carbon impact of it, particularly for primary care colleagues.
Thanks, Ben. And Marcia Philbin, and maybe quickly tell us who you are. I forgot to remind people about that.
Yeah, hi, I'm Marcia Philbin. I'm the Chief Executive of the Faculty of Pharmaceutical Medicine. And my question was in relation to the prevention piece that was discussed in Dr. Tun's presentation, and the issue of trust, particularly from underserved communities. And I was just wondering if there's been any research into the human factors that influences behavior of patients, particularly when they do not trust the medical profession, and it is those communities that present later. And therefore, when you're talking about prevention, how do you address that? Thank you.
Right, let me go to our three speakers. So you don't need to answer every question, but if you'd like to pick out some points. So Anya, would you like to go first?
Sorry. About the training, there's quite good training in simulated environments. Sometimes these are uncomfortable conversations to have, often because the patient doesn't want the conversation, but we have trouble initiating it. I think medical students in general now are much better communicators than, say, my generation were, and that's because they're taught some tools and they practice it in safe environments. And so I think we can do a lot about making our doctors feel comfortable dealing with uncertainty, talking about prognosis, talking about not intervening rather than intervening, if we allow them to practice it in a and find phrases that they have to hand then to get them into the conversations. And I think they're starting from a good place. So that's what I would like to.
Right. Sanyu May?
Yeah, starting with the one about social prescribing. Yes, there is very good evidence that social prescribing reduces costs. So in Frome, for instance, they showed that actually in primary care, where they had done social prescribing in that area, that community had fewer admissions to hospital, and that there were much less healthcare costs. I think healthcare costs reduced by 15% from memory, and that the patients were fitter and more well and so forth. So there is very good evidence that social prescribing works. The question about human factors, that's not really my field, but I would say that if, I sometimes talk about the industrialization of healthcare. The healthcare industry as putting through patients as sort of like items, rather than these are people that are here because they need help. And I guess it's just about dealing with people as people and meeting them where they are and understanding their needs, listening to them. So if you have healthcare professionals that listen to people and try and understand their needs, see where they're coming from, then that would increase trust. And basically that is what we're trying to make. We're trying to make good doctors that inspire trust, and other healthcare, I mean medical education, but other healthcare professions likewise.
And Sonia May, have you got anything to say about decision aids?
Well, only as much as when I teach, I teach about the NICE decision aids. So the NICE website has got a whole list of decision aids for particular things. So statins, for instance, or asthma control. And if you go on the NICE website and look under patient decision aids, they've got masses of stuff, and that's all just growing all the time.
Thanks. Parveen?
Yes, thank you very much. Interesting conversation. So in terms of training, every specialty, I think most of the specialties now have got on their websites on how to reduce their carbon footprint. And certainly we've got one, I'm a gastroenterologist, we've got one for endoscopy, what you can do, in terms of reusable plastics, in terms of reusable fluids, in terms of what you clean your instruments with all the toxic agents. There are others that you can do. So there are guidelines for that. The second thing I think in terms of reducing the carbon footprint is actually have a champion who goes around and looks at every single area. And we've got a very good one who goes on and says, so what are you doing? So why are you using that? Why don't you use it? So with that, the idea that we all need to then become, green champions is not a bad idea. And the third thing I really want to do is to get the students to do projects. To get them to do projects on whichever ward they want to, or any topic they want, but something to do with sustainable health, with global health, with planetary health. And that gets, once they've got data, and I think always, if you've got data, that's so much more persuasive than just saying, do this, do that. So I think some very, very good points have come out. Thank you.
Thanks, Parveen. Rory Gibson, would you like to ask your question, if you're there still?
Hello, thank you all so much for everything you said this afternoon. It's really been fantastic, and many of you have actually answered in part the question I have. So I work as a junior doctor within medical education up in Inverness, so chiefly with University of Aberdeen students, and I'm one of two members of faculty here that are responsible for arranging or delivering a sustainable healthcare tutorial, and we only get an hour, and that's 1 hour out of a 5-year course, and that's all the students get. So we have a very limited time to kind of engage, capture interest, inspire for people to kind of take sustainable healthcare on with them. I'd love to see sustainable healthcare integrated at every level, but at the moment that's what we have. And I just wonder, from your experience, are there any particular topics that you feel are particularly good within the massive topic of sustainable healthcare that engage people? We do a lot about kind of low carbon alternatives like inhalers, and we talk a bit about active travel and the Green Theatre project as well. But I just wonder, from your experiences, are there any particular topics that you feel are particularly inspiring and engaging?
Thanks.
And that's to all of the panel.
Right, yeah. And Richard Thomas?
Thank you. Look, it seems so. I'm a GP in Swansea. I'm only peripherally involved with the medical school in Swansea, and I have delivered some teaching on that, and aiming to get at the GP training program locally. It seems to me that there's a lot of effort goes into trying to deal with how we can reduce carbon footprint for individual patients, but actually we need system change for a lot of this, and so the educational effort seems to be directed at dealing with individual patients and individual items of reduction of environmental impact, rather than the system change. And how can we develop and expand that teaching on system change that we actually need to deliver big changes? That's my question. Thank you.
Thanks, Richard. And Nikki M0921, sounds exciting.
Hello, My question was just relating to the exams and assessment. So I'm a medical student and I've been trying to get this into the curriculum more, but the main area of resistance that I faced is that people think that students won't take interest or, you know, will just ignore the content if it's not being assessed on. So I was just wondering if you had any resources or like guidelines for how educators can assess this content.
And Nikki, can I ask you, where are you a medical student?
University of Birmingham.
Right, thanks. Right, there we are. We've got 6 minutes left. 3 good questions, tough questions. So Parveen, would you like to go first this time? Don't feel you have to answer everything.
So I shall do it. Thank you very much. In terms of curriculum, just to say that within 5 years after me pushing it for 30 years, we had 1 hour of global health. It then went on to 1 day and then on to 2 days non-compulsory. Now it's a week of compulsory. So I think we can get it done. Secondly, a huge curriculum, you know, where do you start? I suggest that every lecture in whatever topic has embedded in it something on global health, because you can always find something relevant to that particular topic. We can't add more on. There's far too much in the curriculum. And what we don't want to do is to get burnout in students and just trying to learn things. But if it can be incorporated in everything, that'd be great. And I can't read what I wrote for the third answer. Sorry about that. I'll pass on.
Well, that's the classic doctor thing, of course. You can't even read your own writing, but it was probably very important.
It probably was.
Sanyu May.
Thank you. I think I'll start with Rory's one about, well, I go with what's most impactful, and I think it's things like prescribing. So we're making doctors and healthcare professionals, and prescribing of medications is one of the most impactful in terms of the health impacts of medical care. And so people ought to be taught deprescribing and how to stop medication before they learn how to put the medication. I mean, you wouldn't learn to drive a train without learning how to stop it first. And so, you know, you shouldn't learn how to prescribe or what prescriptions to, what medications to use without knowing when that has to end and the circumstances in which they should end and how to end it. So that should be built in. So, and also things like rationalizing investigations so that people get penalized for doing a scattergun approach for ticking every investigation in the boxes. And one other thing, I suppose, is to teach about talking about prognosis. That terrifies people. It terrifies, and how to teach how to say that to relatives, how to talk to relatives about, I want everything done from my mum or whatever it is, but what does that really mean? And is that what your mum really wants at the end of life, for instance? Those are the kinds of things that you can teach in a generic sense, but it's a skill for life. There was a question on assessment, and I think, you know, it's got to, I think every person who writes an assessment has to think about sustainability. That's the way to do it. Put something in with the format of the assessment that says, how has sustainability been incorporated into this assessment?
Right, and thank you. Anya?
Yeah, I think the question writing is actually quite difficult when you're involved in it and making it fair and assess what you want to assess. So I think there's something about teaching our question writers how to evaluate something, but things like penalizing if you have a scattergun approach. Which of the following things would you or prioritize the following tests, and you're only allowed to have 2, stuff like that. With regard to teaching in small groups, and Rory, your hour with your students, I'm guessing nearly every one of them has an interaction with a grandparent or a relative who has a medical condition. And it's very easy, in my experience, to get them to share their experiences of medicalizing death, or and I think with sensitivity you can do that and think, how could that have been better? Investigations can be really frightening for patients. We think nothing of them, and they can be ruminating and really distressed about the result of the Czech CT scan. I had a lady on Monday. It was normal, it was fine, but she was absolutely on tender hooks, and nobody thought to tell her. And actually, you could question whether it was necessary at all in the first place. So that sort of understanding, and that each one of them will have the responsibility to decide, is this test necessary, and empowering them to defend it. And what's the worst that can happen? They have to do it a week later, you know, kind of just allowing them would be my.
I noticed that none of you took up the question on systems change, and I understand why, because that's a very hard question. Anya, you did have it on one of your slides. I don't know whether you've got anything. I mean, I think the reality is we know it's important. We don't really understand how to do it.
Yeah, I think that's very true. And some of our leadership training courses do cover trying to change systems. And the problem, of course, is because, and the reason we didn't pick up the question is that medicine has become an incredibly complex business. But we do think that clinicians, whether they're doctors, nurses, that they make better managers of our hospitals. And I think if we can, that outcomes for patients are better, and that patients perceive their care as better. So I think that's one of our missions at the RCP, is to try and create a group of leaders who practice introducing small system changes, so that as they get more senior, they will hopefully have the skills and the tools to impact on larger systems. But very, very hard one.
Thanks, Sonia.
Can I just get Anna Jones, who's written a point at the bottom of the chat. Anna, if you could please read that out. Anna was one of my colleagues that worked on this curriculum. Is Anna still here?
You there, Anna?
My camera's not working. Yeah, it's just from my own experience that my colleagues often think this is about complex life cycle assessments, carbon footprinting, very technical, and that there's still very much a perception that this is about physical waste, single-use plastics, recycling, etc. And I think thinking about wasted clinical activity is something that most clinicians are really well versed in and really, really aware of, and just making that very explicit, which we in this room are all very familiar with, but I don't think that message is already that clear, always that clear.
Thanks, Anna. So, I mean, I couldn't help thinking, I mean, we know that drugs are 25% of the carbon footprint of the NHS, and we know that half of drugs are never taken. So there's a place to start. So just to quickly, I mean, I would like to end on an optimistic note, and I would say that I've seen enormous change in the energy of our members in the last 2 or 3 years. A combination, I think, of Greta Thunberg, Extinction Rebellion, the fact that lots of this is already here, is not in the future, has kind of galvanized people. And I think it's going to galvanize educators too. There's lots of good stuff in the chat, actually, if you have a chance to look at it, including some links. All of this will be available as a recording. There may be a podcast, as Anya said, from the Royal College of Physicians. So I want to end by thanking all of our speakers for what I think has been a very useful and provocative session. And I hope a couple of years from now it will be, you know, that it'll be routine, that sustainable healthcare is part of the curriculum of every health professional, both as undergraduates and postgraduates. So thank you very much. Bye-bye.